All right, good morning, everyone. Thank you so much for joining the Community Health and Healthy Aging Funds Technical Assistance Session 1, Understanding RFP and Eligibility. My name is Chen Hens. I'm the program associate here, and I also have two of my colleagues here, Kaylin and Albia. Do you want to spend a little time to introduce yourself?
Sure. Very briefly, hi everyone. I'm Bia Altine Gibson. I serve as the director for the funds and I work at Health Resources in Action. I'll pass it to my colleague, Caitlin.
Thanks, Albia. My name is Caitlin Figueroa, and I'm the program officer, for the funds. And it's good to see you all here today.
Thank you both. So before going into more details, I just want to show some housekeeping items. If you have any logistical or content questions, please type them into the chat box, and closed captions, transcriptions is available upon request, and click the CC, like there's more. Click more, and then captions, you will have the captions on. So if you have joined our previous sessions, you probably already have seen this multiple times. I won't go through like more details on this, but just a quick glance for you and see the available funding is $15 million. We expect to make 20 to 25 awards, and the grant start date is July 1st. Application deadline is March 29, 2024. At 11:59 p.m. Eastern Time. I will go through the eligibility and some of the frequently asked questions at this session. So let's talk about who is eligible to submit your proposal for the funding opportunities. Massachusetts-based nonprofit 501c3 organizations or groups with a 501c3 fiscal sponsor, quasi-governmental organizations and municipalities are eligible to apply. In addition to the major requirement, so for this round of funding, the fund will have some prioritizations here. You can see for communities that have not historically and routinely benefited from DON funding and have high risks of health inequity, and strategies may focus on geographic or population-based communities at the local, regional, or statewide level. The funds will also accept from agencies and organizations geographically based in Boston who are interested in doing health and racial equity work statewide or in community outside of Boston. You probably have a lot of questions related to the funds prioritizations, but please hold all your questions and we will talk more about this later at the FAQ session. Some of the ineligibility for ineligible applicants, one is current grantees, but if you are a regional planning agency or a statewide organizations and who are in their final 2 years of your current grant can apply for an approach that reaches a different geography or population. Another ineligible applicant is hospitals for-profit business, and college universities are not eligible to apply as the lead applicants, but in places where they play key roles as an anchor institutions can participate as a partner with community-based organization as a lead applicant. Hospitals that have contributed DON funds are not eligible to receive any funds. Eligible activities including purely research projects and capital expenditure. We have received a lot of questions related to capital expenditures. So people are asking what is capital expenditure. So this is it is but not limited to new constructions, the renovation of existing facilities, or other fixed assets. For some other budget-related line items, for example, like staffing salaries, stipends, or office supplies, as long as those are related to your project and community engagement, they are eligible to list on your budget, but the reviewers will review your proposal and budget to see if they are feasible to your project. Here is a comparison for all the three funding streams, and we can look at each of them one by one. And so for approach, PSC is focusing on policy, system, and environmental change approaches in the local, regional, or statewide level. CHIP is focused on local and regional community health improvement planning. Healthy aging is focused on policy, system, environmental change approaches, local, regional, or statewide level. For priority geography, so PSC focus on outside communities outside of Boston that are not historically and routinely benefited from DON dollars and have high rates of health inequities. CHIP communities outside of Boston that have not historically and routinely benefited from DON, which is the same as the PSC ones. Healthy aging ones a little different. They focus on gateway cities and rural areas. For priority populations, PSC and CHIP are the same. They focus on high rates of health equities, community with high rates of health inequities. Healthy aging are focused on older adults and community with high rates of health inequities. Some people have asked the question, healthy aging is focusing on the lifespan or just older adults? So this is only focused on older adults. So all the organizations or coalitions who meet the eligible criteria can apply for each of the three funding streams. Award amount for PSC, all and CHIP and healthy aging, all the planning grant are up to 50K per year, 1 to 2 years. And PSC full grant up to 200K per year, 3 to 5 years. Full grant for CHIP up to 370. No, sorry, it's up to 75. 375 total, 3 to 5 years. And full grant for healthy aging is up to 100K per year, 3 to 5 years. For healthy aging, you probably have seen this graph in the past. It's 8 domains of livability framework. For this funding cycle, we prioritize transportation and housing. CHIP here in this graphic, you can see CHIP is a circle. And so phase 1 is assessment, 2 is planning, 3 is implementation, the 4th one is monitoring and evaluation. So for this funding, we prioritize assessment and planning. Some of the key elements for assessment, including engaging community members and stakeholders, defining the community, employing equitable data collections, etc. And the planning phase, including the key elements, are engaging strategic partners, setting goals and objectives, assembling an implementation team, etc. So we have those on our CHIP questions. You can find those on our website. For planning grant, we have talked about that in the past. And so if you're an organization that want to transition from a short-term program approach to a PSC approach, we provide this funding opportunity for you. We will provide capacity building and technical assistance with upstream approach and helping you with your work towards PSC change. Please make sure that entities cannot apply for a planning grant and a full grant at the same time. Here are some FAQs. You might have a very similar questions. So hopefully this is helpful to you before we enter into the Q&A session. If you have questions beyond those are listed here, feel free to ask later. First question is, are organizations who have previously received funding from HRA through another grant program eligible to apply? Yes, so if you were funded by another grant program at HRA, you are still eligible for this funding opportunity. While HRA is a fiscal agent responsible for implementation of the funds, they're overseen by the Massachusetts Department of Public Health. Second question is if we're not a certified 501c3 organization, can we apply through a physical agent that is? Absolutely, yes, you can apply with a nonprofit organization that serves as your fiscal agent, meaning it would receive and manage the grant funding. If you're applying as a lead organization, it is expected that your organization would be performing the majority of the work, and that most of the funding will be used to support your proposed activities. Proposed budgets should include no more than 20% for indirect or overhead costs of your organization or fiscal agent. Indirect costs do not include fringe benefits or payroll taxes, which should be budgeted as part of your proposed personnel costs. And some of the fiscal agent may ask, can a fiscal sponsor apply for the funds as a lead organization? The answer is yes, a fiscal sponsor can apply for the funds as a lead organization separately from the organization that you are sponsoring. The next question, if we have received local DON money or will receive money from local DON, are we still eligible to apply? We have received these questions a lot, and so the answer is yes. You are still eligible to apply, even if your primary service is focused in the city of Boston. You are still eligible to apply. So the city of Boston is not our funding priority geography. We recommend those that primarily serve in the city of Boston to consider expanding their scope to include areas outside of Boston. Another question, what kind of activities can we propose? Can funds support general operating costs? Organizations should propose activities that fit the purpose described above and meet the unique needs of their communities. Proposed activities should complement and enhance existing efforts in the community. A range of unique and creative ideas are welcome and will be considered. Organizations can propose ideas that build upon existing efforts or establish new ones. The next question is, if your community is predominantly white, is that a disadvantage for the racial equity focus of these funds? The answer is no, this will not be considered a disadvantage. The funds use an approach known as leading with race and racism. This approach recognizes that people of color in Massachusetts have historically and consistently had less opportunity to lead a healthy life. The funds also recognize that the root causes of health can create barriers to health for all types of populations, including those that are predominantly white. As a result, the funds want communities to lead with race and racism explicitly, but not exclusively. We will prioritize approaches that impact communities, whether geographic or population-based, that experience high risks of health inequities. We encourage applicants to explain how their approach will work to disrupt the root causes of health inequity through policy, system, and environmental change approaches. So here are some of the application materials you can find on our website. So for PSC, CHIP, Healthy Aging, each you can see their full grant and planning questions on the website. And please note that the application portal is the same for both planning and full grant. So, but you have to select which grant you're applying. We will talk about more about the application portal in February TA sessions. If you're interested, you can always register. We also have the work plan template and budget template here listed. The last but not least is the FAQ page. This page is under Apply tab on the top. We have been updating the FAQ page to up to date. You can find most of the questions and answer in this page. If your questions is not listed here, feel free to email us your specific questions. We'll try to get back to you as soon as we can. Yeah, we're done with our presentation, so we're gonna move to the question Q&A time. Before doing that, I just want to mention again, please visit our website, and here is our email. If you don't have it, we can list in the chat. You can always email us and ask questions. Thank you, everyone. I'm gonna move to the Q&A session. Feel free to ask any questions. I'm gonna stop recording here.